Why menstrual cramps happen. It's common to feel discomfort around your abdomen, lower back, and thighs when you're menstruating. During your period, the muscles of your womb contract and relax to help shed built-up lining. Sometimes you'll experience cramps, which are your muscles at work. Some women and girls may experience nausea, vomiting, headaches, or diarrhea as well. Doctors aren't sure why some women experience painful menstruation and others don't. But some factors that are associated with more intense pain include having a heavy blood flow, having your first child, being under the age of 20, or just starting your period, having an overproduction of or sensitivity to prostaglandins, a hormone that influences your womb. Other factors include growths in your womb, endometriosis, abnormal uterine tissue growth, and use of birth control. For mild to temporary cramps, some home remedies can help provide relief. Read on for tips on getting fast relief and learn how to potentially lessen the pain during your next cycle. 1. Taking over-the-counter (OTC) medications. Nonsteroidal anti-inflammatory drugs (NSAIDs) are the primary over-the-counter (OTC) form of pain relief recommended for menstrual pain and heavy menstrual bleeding. NSAIDs include ibuprofen, Advil, and naproxen, Aleve. These drugs help lower your body's production of prostaglandin. NSAIDs aren't as effective as oral contraception, but they can help reduce pain. 2. Applying heat. Applying heat to your abdomen and lower back may relieve pain. A 2012 study focused on 147 women 18 to 30 years old who had regular menstrual cycles found that a heat patch at 104 degrees Fahrenheit 40 degrees Celsius was as effective as ibuprofen. If you don't have a hot water bottle or heating pad, take a warm bath or use a hot towel. Or you can make your own heating pad. Cut and sew together 2 pieces of fabric, leaving a hole at the top. Fill with uncooked rice and sew up the hole. Microwave for a few minutes to the desired temperature. Don't overheat. Let cool, if necessary. Or wrap your homemade pad in a towel to reduce heat transfer. Reuse as necessary. You can also purchase a heating pad online. 3. Massaging with essential oils. Massage therapy for about 20 minutes can help reduce menstrual pain. One 2010 study trusted source looked at 23 women with period pain caused by endometriosis. The researchers found that massages significantly reduced pain immediately and afterward. Massage therapy for menstruation involves pressing specific points while the therapist's hands move around your abdomen, side, and back. Watch this video for a tutorial on massaging for menstrual pain. Adding essential oils for an aromatherapy style of massage may have additional benefits. A 2012 study divided 48 women experiencing menstrual pain into 2 groups. One group received a cream containing essential oils, while the other received a cream containing a synthetic fragrance. The group who used essential oils experienced a significant reduction in amount and duration of pain. The researchers used a blend of lavender, clary sage, and marjoram oil in this study. You can buy a scented massage oil with similar ingredients or make your own. You should always dilute your essential oil with a carrier oil. Examples include vegetable or nut oils such as grapeseed or sweet almond oil. A safe concentration is 1 drop of essential oil per teaspoon of carrier oil. 4. Having an orgasm. While there are no clinical studies on the direct effect of orgasms on menstrual cramps, science suggests it may help. Vaginal orgasms involve your whole body, including your spinal cord, which signals the release of neurotransmitters. A vaginal orgasm can trigger your brain to release neurotransmitters such as endorphins and oxytocin. Endorphins can decrease pain perception. Dr. Barry Komisarek, a psychology professor at Rutgers University who studies the female orgasm, told the BBC, "Vaginal orgasms are described as being internal and involving the whole body. That's probably because the nerves that carry sensations from the clitoris are different from the nerves from the vagina." His 1985 study trusted source with Dr. Beth Whipple was the first to find that vaginal self-stimulation doubled women's tolerance for pain. 5. Avoiding certain foods during menstruation. It's a good idea to avoid foods that cause bloating and water retention. Some of the biggest culprits include fatty foods, alcohol, carbonated beverages, caffeine, salty foods. Reducing or cutting out these foods can help alleviate cramps and decrease tension. Instead, try soothing, caffeine-free, ginger or mint teas or hot water flavored with lemon. If you need a sugar fix, snack on fruits such as strawberries or raspberries. 6. Adding herbs to your diet. These herbal remedies contain anti-inflammatory and antispasmodic compounds that experts believe can reduce the muscle contractions and swelling associated with menstrual pain. Herb or supplement dosage. Does it work? Chamomile tea. Sip 2 cups of tea per day a week before your period. You may benefit more if you drink it every month. A 2012 review of studies reports chamomile tea increases urinary levels of glycine, trusted source, which helps relieve muscle spasms. Glycine also acts as a nerve relaxant. Fennel seeds. When your period starts, take 30 milligrams of fennel extract 4 times a day for 3 days. A 2012 study looked at girls and women 15 to 24 years old. The group that took the extract reported feeling relief. The placebo group reported none. Cinnamon. Take 840 milligrams of cinnamon capsules 3 times a day during the first 3 days of your period. In 2015, women who took cinnamon capsules in a study reported less bleeding, pain, nausea, and vomiting compared to the placebo group. Ginger. Try grating a small piece of ginger into hot water for a warm cramp-relieving drink. One study of university students found that 250 milligrams of ginger powder 4 times a day for 3 days helped with pain relief. It also concluded ginger was as effective as ibuprofen. Pycnogenol. Take 60 milligrams of pycnogenol per day during your cycle. This can help with more moderate menstrual pain. A 2008 study trusted source found that women who took 60 milligrams of pycnogenol per day during their cycle reported less pain. According to the study, the benefits increase as you take the pill and continue even after you stop. Dill. Try 1000 milligrams of dill for 5 days, starting 2 days before your cycle. A 2014 study trusted source concluded 1000 milligrams dill was as effective for easing menstrual cramps as mefenamic acid, an OTC drug for menstrual pain. Relief for premenstrual syndrome symptoms. Curcumin, a natural chemical in turmeric, may help with symptoms of premenstrual syndrome (PMS). One 2015 study looked at 70 women who took 2 capsules of curcumin for 7 days before their period and 3 days after. Participants reported significant reduction in PMS. If you want to give curcumin a try, check out this recipe by In Jenny's Kitchen for turmeric tea. Curcumin supplements are also available online. Caution: always make sure you're buying herbs and supplements from a reputable source as they aren't regulated. While most of these herbal remedies have few side effects, check with your doctor before trying them. Some herbs may also cause unintended side effects, especially if you're taking medication. Most of these herbs and supplements also don't include specific instructions for menstrual periods. Your doctor may have more information on dosage recommendations. How diet and exercise can help in the long run. Maintaining a healthy diet and keeping up a regular exercise regimen can go a long way toward preventing menstrual pain. A 2016 study trusted source of 250 women found significant differences between period pain in women who maintained a healthy lifestyle and those who didn't. Read on for specific diet and exercise tips. Diet. Generally, a diet geared toward decreasing menstrual pain should be high in minimally processed foods, fiber, and plants. Give these foods a try. Papaya is rich in vitamins. Brown rice contains vitamin B6, which may reduce bloating. Walnuts, almonds, and pumpkin seeds are rich in manganese, which eases cramps. Olive oil and broccoli contain vitamin E. Chicken, fish, and leafy green vegetables contain iron, which is lost during menstruation. Flaxseed contains omega-3s with antioxidant properties, which reduce swelling and inflammation. Boron. This mineral helps your body absorb calcium and phosphorus. It also reduces menstrual cramps. A 2015 study that looked at 113 university students found that boron reduced the intensity and length of menstrual pain. Foods with high concentration of boron include avocados, peanut butter, prunes, chickpeas, bananas. You can also take boron supplements, if your diet doesn't provide enough. However, you should consult your doctor before taking boron supplements. Discover how boron helps the brains and bones, too. Water. It sounds odd, but drinking water keeps your body from retaining water and helps to avoid painful bloating during menstruation. Warm or hot water is usually better for cramps, as hot liquids increase blood flow to your skin and may relax cramped muscles. You can also eat water-based foods to increase your hydration, including lettuce, celery, cucumbers, watermelon, berries, including strawberries, blueberries, and raspberries. Calcium. This mineral can help reduce muscle cramping during menstruation. The Mayo Clinic recommends at least 1,000 milligrams mg per day for women between the ages of 19 and 50. Foods high in calcium include dairy products, sesame seeds, almonds, leafy green vegetables. Calcium is also available in supplement form. But speak to your doctor before taking supplements to find out if it's safe for you. Exercise. The idea of exercise immediately before or during your period may not appeal to you. But exercise releases endorphins. Research suggests exercise is effective at reducing menstrual pain to the extent it may also eliminate or reduce the need for pain relief medication. Moderate activities such as walking can be beneficial during your period in place of more strenuous activity. Yoga is a gentle exercise that also releases endorphins and helps prevent or reduce menstrual symptoms. In one 2011 study, researchers found 3 different yoga poses, cobra, cat, and fish, significantly reduced intensity and duration of pain during menstruation for young women ages 18 to 22.